Hey there, Dr. Todd Cameron here, GP and founder at M3 Health. I wanted to chat to you today about where we are currently at with the COVID vaccination state of play in Australia and particularly in our local area where our clinics are. The phase that we are currently approaching is the 1B phase. So phase 1A is being done via hospitals mostly, and that is underway. That included aged care and frontline health workers, hotel quarantine, etc., and a few others in that group. We are about to start the 1B phase, which is very much focused around general practice, delivering the AstraZeneca vaccine to the community. You remember 1B is Australians 70 and above, Aboriginal and Torres Strait Islanders that are age 55 and above, people with specific complex or serious health conditions, the rest of the healthcare workers that are not part of the 1A phase, and essential and critical services such as fire, defence, emergency services, etc. So those are all part of 1B. So what the federal government have done is they've slowed the amount of vaccine that will be received first up. And we've said we could do between 1,000 and 2,000 vaccinations per week. We are starting with 50 vaccines, so a much, much smaller number than what we originally suggested we could deliver. And so what that means is we're going to use the first few weeks with the 50 vaccines just to do some really careful testing of the systems and processes that we've built. And they will be invitation only to the people that are in 1B. So these will not be publicly available via the booking app yet. We will do that once we get the minimum supply for that, which is about 300 vaccines. So we're going to make it invitation only to get the most vulnerable people in that 1B, reach out to them, get them in. It's likely that we can run the clinic more slowly in the early stages just to get the tweaks right on all of the systems and processes, so that when we do get to large volume, and when we're getting to large volume, we're going to be doing 60 patients per hour or thereabouts. So it's going to be pretty fast moving. It will be that we do this through a digital process. And if you have any questions, we're going to need you to book a consultation with your regular GP that is not part of the vaccination clinic before you go into the vaccination clinic. That's just so that we can make sure that we can continue to move fast there with only people booked in that are ready to have the vaccine and agree to the consent process. So if you're not in that process, then we will have a little tile around here that will get you to book a telehealth if you have been seen in the clinic in the last 12 months, or it will need to be a face-to-face consult, which is just a COVID vaccine chat, and we'll have a bit of a conversation with you if you're not sure if it's right for you. If you know that there's no way you're having it, and we're going to say that you're a red light, that means that you're not interested in having the vaccine, that's fine. Listen up and pay attention to all the information that's coming through. So that in future, if you're watching the government information or after a conversation with your GP, you change your mind and you are comfortable to have it, that's cool. We'll always be able to get you in and have that vaccine. And if you're green, so you know you can have it, and you can follow the tech and you can consent through the tech, that's fine. You're in the green group. Everybody else is in the orange group, where they'll benefit from a consultation with their usual GP, because it's really important to have that conversation with your own GP who knows your health really well, and have a conversation about what's involved in vaccination prior to actually showing up at the Vax clinic. So we think that we're probably going to have full numbers of vaccines, which relates to CSL producing the vaccine onshore. The first vaccines are imported vaccines, we understand. And so what that means is that we'll probably get up to full speed around mid-April. We will keep messaging you and updating you as to what's going on. Please do not call the practice for information on this. Our phone systems are already overwhelmed with people making inquiry. So please rely on the digital form of communication. Make an appointment with your GP if you have any questions at all, but make sure it's your usual GP. I've been Todd Cameron. Have a great day. Bye.